my interview presentation. So the three key lessons that I found most relevant to the profession of nursing were active listening, obstacles to listening, collaborative leadership, and these all have importance in patient care, collaboration, and leadership among nursing. Some of the key themes throughout my essay and this presentation are trust, empathy, and effective communication. Active listening in nursing. Active listening is a communication technique used to fully understand a speaker's message and emotions. It involves more than just hearing, it's about engagement and empathy. Listening in nursing helps build trust, demonstrates empathy, and ensures that patient concerns are fully understood. This leads to better care outcomes as well. Um, Nurses must also understand and respond to patients' feelings and experiences, creating a sense of emotional connection. Um, we might not ever be able to understand um, exactly what someone's going through. However, we can imagine what it's like to be in someone else's shoes. Um, Acknowledging feelings, acknowledging the emotional state of the patient shows you respect and understanding of their situation. And it shows that you also care more about, that patient as a person as well as their health. Um, Body language is also very important. Nonverbal cues and stuff like maintaining eye contact, having a good posture, and small, verbal affirmations like "I understand," "Okay," and just to guide the conversation along. Obstacles to effective listening. So we have emotional reactivity, where nurses may experience emotional reactions like frustration or anxiety or being burnt out, and it can interfere with effectively listening to a patient. Nurses need to be aware of their emotions and avoid overreacting, um, or avoid reacting emotionally rather, um, in patient interactions. So that would look like, when someone's clearly upset, trying to approach the situation in like a calm voice, or, just taking a pause, taking a deep breath, taking a minute or two to separate yourself from the situation and, control yourself and be more calm. Judgment, nurses may have preconceived notions about a patient, their lifestyle, or condition, which can cloud their judgment. Um, and nurses need to remain non-judgmental because acknowledging patients' unique, um, our nurses should strive to remain non-judgmental, acknowledging patients' unique experiences and needs, um, and not judging them off of that, but attending to their needs and listening to what they need to get better rather than focusing on what they've done or the mistakes they've made. Collaborative leadership in nursing. So it involves working together with healthcare teams, valuing each person's contributions and ensuring patient care is cohesive and efficient. Um, Being conscious of others, also very important. Nurses need to pay attention to their colleagues, abilities, emotions, and perceptions. Understanding team dynamics leads to better collaboration. Um, Authenticity, really important, goes hand in hand with, honesty, and that goes hand in hand with trust, which is essential in, having a working relationship with anybody. Mutual respect, um, respecting everybody's role, everybody's position, and unique things that they bring to the work environment will ultimately improve patient outcomes and staff cohesiveness. real insights from my interview. So empathy and body language, Jennifer explained that starting an interaction simply by introducing yourself and just being there and engaged with the patient, doing things like making eye contact, you know, responding in little ways or, probing for information, oh, tell me more about that, you know, stuff like that. Um, you know, but I would say like the most important part that Jennifer emphasized was starting small, just with that introduction and explanation, Also avoiding judgment. That's a really big thing that Jennifer shared, and you know, it judgment can affect the care that people receive, and their symptoms can be minimized. So we really want to avoid that. Um, Emotional reactivity and conflict. Jennifer also said, you got to stay calm. You can't ever, scream in front of the patient or scream at someone, in the heat of the moment. Take your time to relax and be very careful with your words when you're actually in the midst of conflict. All right, so key takeaways that I had. Um, First one is active listening in nursing. Listening actively with empathy and body language helps nurses connect with patients and understand their needs, which leads to better patient care and better patient outcomes. Overcoming listening barriers. So nurses must be aware of emotional reactivity and judgment, as these can hinder effective communication. By staying calm and non-judgmental, nurses can foster trust with their patients. Collaborative leadership. So collaborative leadership values every team member's contributions. Leaders need to be authentic, respectful, and conscious of others' feelings to create a work environment that's, conductive to quality patient, conducive to quality patient care. Reflection and application. So the lessons from this course, particularly the importance of active listening and collaboration in leadership, it's going to directly impact my career in nursing, especially as an emergency room nurse. Empathy is something I'm going to be using every day. I plan to apply it, just being a witness to the patient's experiences and actively listening to their concerns, and not just their concerns as a patient, rather their concerns as, another human being. Um, Avoiding judgments. So in the fast-paced environment of, the ER, I want to work hard to avoid making judgments about patients, because each patient's story is unique, and it's essential to listen to them fully before making, any sudden conclusions. Collaborating with team members, I'll take the time to get to know my coworkers, respect everybody's roles, communicate in an open manner, um, and that'll ultimately lead to smoother teamwork and better patient outcomes. So conclusion: effective communication, active listening, and collaborative leadership are vital to providing quality care in nursing. These skills build trust, improve patient outcomes, and create a better work environment. Insights from this interview and the course will shape my future in the nursing practice, and it's going to enable me to work more effectively with both, communicating with both my patients and my healthcare team. Thank you.